My name is Tiago Bilhim. I'm an interventional radiologist specialized in embolization treatments, and I came from Lisbon, Portugal.
And when did you arrive in Dubai?
I arrived in Dubai on Thursday because we had a pre-meeting workshop dedicated to medical writing and scientific writing with both CVIR journals and AGIR journals. So I arrived a little bit before the start of the meeting.
What sessions and workshops are you participating in?
So we started with this workshop on scientific medical writing just before the start of the scientific meeting. It was quite an important workshop because we're having more and more junior RARs who are keen on learning how to write scientific medical papers. So it's really important that they attend these workshops. I'm going to also have more lectures in the following days. So I'll be covering also MSK embolization, prostate artery embolization, uterine artery embolization. So overall, a lot of assignments over the next 3 or 4 days.
Out of all the topics within your presentations, which one of them would you like to highlight to the audience?
Yes, I think we're evolving as medical specialty, and we're always having new procedures. So we've just had a focus session of PAIRS meets Suggest when we're talking about MSK embolization. So we were really trying to unveil and learn from our history, our recent history on prostate artery embolization, and see where we need to go to put MSK embolization at the same level.
So without giving away too much detail of the MSK presentation, can you give us some highlights of that presentation?
Yeah, so basically MSK embolization is a portfolio of different clinical scenarios. So we really have a lot of different clinical contexts that range from knee osteoarthritis, frozen shoulder, which are the two most common indications that have the largest body of evidence. And then we have a lot of new clinical scenarios with potential for future growth and development, but overall message is that we really need to standardize outcome measures for each specific clinical scenario, and also standardize the technique and the embolic agents that we're using.
For your MSK presentation, how does that topic impact the practice of interventional radiology?
I think it generates an awareness between IRs who are keen on starting new procedures, specifically starting embolization procedures for musculoskeletal conditions, to really understand that each clinical scenario is different from another, and you really need to focus on how you evaluate patients and how you follow up patients and how you standardize the technique so that you make sure that you really get the best outcome with the least possible adverse events, and you report those results in a standardized and reproducible way.
You have been a key opinion leader on prostate artery embolization procedures. How can the IR community benefit from that experience gained from prostate artery embolization and carry it over to MSK embolization?
So we just looked at how the history of PAE has developed over the last 15 years, and we had to pave way through a lot of different trials. So we had to go through animal studies, first in man, phase 2 trials, prospective trials, phase 3 comparative trials, sham controlled trials, a lot of data with thousands of treated patients and controlled randomized trials to really have the solid data to be able to fit in the guidelines and be able to understand where those treatment options may lie within all the treatment portfolio for the different diseases.
Have you participated in the PAIRS conference before?
Yeah, I've been at PAIRS both on present and online because of COVID. So actually this is my first on-site presence after COVID. PAIRS was the last meeting I was in presence just before the COVID lockdown. So it's always a pleasure and a bit of sense of enthusiasm that I came to this meeting, always to meet good friends from all over the globe. So this is actually a meeting where you get to see people from all over America, Europe, Asia. So it's in the middle of all the IR community.
Have you had a chance to explore Dubai since you've been here?
Yeah. Well, not this time. Actually, during this time, I've been at workshops and presentations, so I still haven't been able to visit anywhere in Dubai. But I've been previously in Dubai, so of course there are a lot of places I always like to go, especially because I have my brother who is living and working here. So I sometimes come here, and we always like to go to the old markets, cross the river by boat, see the souks. So these are all the old city, the old town is always very appealing and attractive.
And when are you leaving?
So I'm leaving on Tuesday early in the morning.